Hello everyone, my name is Dr. Carlo Oger. I am an emergency board certified physician with DrER.tv. If you're watching this video, you're actually watching my channel ED Exit Video Pro, which is a channel specifically directed at people in the healthcare industry, nurses, pre-nurses, medical students, residents, anybody who wants to learn more. I'm making these videos on clinical cases, x-rays, EKGs. In 5-6 minutes, we'll discuss and learn a whole bunch. So this one's about rashes, and rashes are always hard because they change from patient to patient and might look different. And this is something we see very common, an area of redness and irritation, sometimes foul smelling in the folds of the skin. And now, honestly, when I started writing this, I thought I knew everything I need to know, but I don't. So you're getting the advantage of knowing everything I should know, which is why I made this video and did a lot of research to put it together for you guys. So let's talk about the diagnosis. The diagnosis is going to be called Intertrigo. Inter means between, and trigo means rubbing. So Intertrigo, in between rubbing. Intertrigo is the non-specific inflammation of opposed skin. It usually occurs in the submammary region, in the axilla, groin, and gluteal folds. In kids, it can also show up as diaper rash. With increased moisture and maceration, the stratum corneum, the superficial layer of the skin, becomes eroded and therefore can lead to problems. It is more common in obese individuals, obviously because the more skin folds. The bigger folds means more skin is underneath that fold, getting wet and macerated and irritated. So weight loss education is very important for these patients present with intertrigo. Risk factors involve incontinence, both urinary and fecal, excessive sweat like hyperhidrosis, poor hygiene, people don't clean their feet adequately and tend to get in between the toes and such, malnutrition, suppressed immune system due to HIV or chemotherapy. Infection can be caused by many different things, including strep A and B, corynebacterium, pseudomonas, fungi, which includes candida and malassezia. The diagnosis is made in the presence of erythema or redness and itchiness, tenderness, or increased sensitivity. Powders with antibacterial and antifungal activity are helpful in preventing recurrence. Now, one antifungal powder that can be used is called Greer goo. It's nystatin, which is an antifungal, plus hydrocortisone, which is a steroid to deal with the irritation and such, and zinc oxide, which is essentially Desitin. So this is very helpful in preventing as well as treating this. Keep the area dry, and sometimes you actually need to dry the area with something. And there's something called Castellani paint. And this is a drying agent that has antiseptic. That means it actually kills bacteria. So keep the area dry and exposed to air. So for example, in the folds of the breast, which is very common to have intertrigo, make sure that the female is wearing cotton-based bras or sports bra because they are made of cotton and then help absorb the humidity. If they sweat a lot during the day, maybe having an extra pair to change during the day. Same thing with the feet. Have an extra pair of socks to change during the day if they sweat a lot. You can control the oozing with moist compress and astringent called Burow's solution. Now, Burow's solution is a triple paste has petroleum, has zinc oxide, and aluminum acetate. So Burow's solution is a triple paste, and apply QS. Now, what does QS stand for? I used to think it stood for quantity sufficient. But of course it's not. This is Latin, like everything else in medicine, make it harder. It's called quantum satis, which just means quantity sufficient. Quantum for quantity, satis for satisfaction, satisfy, so enough amount. So when we write prescriptions, we write use 2 pills BID for 5 days, QS, quantity satis, quantum satis. I used to think it was quantity sufficient, but it's actually quantum satis. So there's a little what do you call that, extra education, a little tidbit for you. Then it's important to air dry the area. I used to tell patients to make sure they take a towel and they dry in between the breasts, in the groin region. maybe an extra towel, not the one they use for their bodies, but a smaller towel, and go in between the toes. And even use a hair dryer on the cool setting, but letting it dry in between the toes on the affected areas and stuff like that. Zinc oxide ointment, which is desiccant, can reduce friction at the site. So that's something we use in kids with diaper rash and so on. And topical steroids, it says here should be avoided, but then in other articles this is recommended. The important thing is there is risk of cutaneous atrophy because the areas are already occluded, they're already skin to skin. So using steroids increases that risk. So you just have to be careful and use them for a little bit, not for a long, long time, because of the risk associated with it. So let's take a look at the pictures then. This one right here is in the armpit, and what you're seeing is a group A strep infection. So this is actually a bacterial infection, painful erythematous plaque with purulent exudate in the axilla on an HIV patient. This is a patient you might consider ordering mupirocin, which is an antibiotic ointment, in addition to maybe some oral antibiotics as well. In this is a kid, and you'll see a well-demarcated erythema and erosion in the perineum of an 8-year-old associated with itching and tenderness. So this one is caused by GAS pharyngitis, like the other kids in the school that had pharyngitis from strep, and this patient actually got strep, but in the perineal area. This is in between the toes, and you can see the whiteness associated with it. That's very characteristic of yeast infection Candida. Candida albicans. You can see the maceration at the web space of the foot. This patient has underlying diabetes mellitus, which puts him at high risk for that. You do a KOH, potassium oxide preparation, shows yeast with pseudomycelial form. And when a culture was done, it did show Candida albicans, which is yeast infection. This one's another web of a toe, but you can see this a little different, not so much white, but a well-demarcated, very red region on that toe area. And that's very important because that gives you the clue that it's not really just candidal. There's erosion of the web space of the foot with bright red base and surrounding erythema. It is tinea pedis, is kind of like it started as a yeast infection, the interdigital with a moccasin pattern, and this patient has underlying hyperhidrosis. That means they sweat too much. But because of this, it led to superbacterial infection of that tinea pedis, which started as a yeast infection, but it grew Pseudomonas. So this patient needs antibiotics, especially directed at Pseudomonal coverage, which is like ciprofloxacin or any kind of the fluoroquinolones would be okay. So now you know everything you need to know about Intertrigo, but let's look at other pictures so you can really anchor in what this looks like. You can see a smaller lesion here at the web space of the hand. You can see this pretty bad infection and a lot of redness and looks infected. So this is something I would definitely do a swab and culture and start the patient on antibiotics to cover for group A strep. You can see sometimes, especially if your feet sweat a lot, you get these cracks in the skin that are extremely painful. You get a little white maceration here, so that could be an early candidal infection. So this is a very small quantity. You would start treating this with antifungal cream and keeping the areas dry as possible. This is a pretty bad one. This is underneath the breast, and you can see all the redness, all the lesions, and this is probably candidal infection. So you do a KOH preparation to make a definitive diagnosis. This is the growing region, so tinea cruris. You can see all the redness going around like that. And this is most often just from the humidity, but I would put the patient on some kind of clotrimazole cream, which is an antifungal, with maybe a hydrocortisone if it's itching or hurting a lot. And this is probably a perineum, like the gluteal fold of a patient, redness and macerations, and that's it. So hopefully you learned a lot. I certainly did. I thought I knew everything I needed to know about Intertrigo, but I didn't, because most of this I would treat as strictly fungal infections, and unless there was secondary signs of definitive cellulitis, I would not think of ordering cultures or considering Pseudomonas or strep, and now I will. And the other thing is I know a little bit more about prescriptions like triple paste, Boro solution, about Greer goo, and about Castellani paint. So those are good things to know. And of course, we learned today what QS stand for, which is quantum satis. I hope you're enjoying this video series. I'm learning a lot doing them, and hopefully you will too. Makes us better healthcare professionals in the future. We'll see you in our next video. Bye-bye.